Okay. Well, look, we talked about the fact that they didn't talk about the big global issues, global development, Africa, climate, AI safety. And one issue they didn't talk about was global public health. So we've had a question from Ezra Helen. And this relates exactly to this. How serious is the new Ebola outbreak? Should we be worried about it spreading beyond Africa, especially with the cuts to US global health funding?
Very good question. The answer is very. And yes, and the cuts to US global health funding are probably part of the reason why this is happening now.
Big plug, as always, for Leading. And people who aren't listening to the back catalogue of Leading, Atul Gawande has done some wonderful stuff on this recently. He was the USAID Deputy Administrator who led on global health. This is something that means a lot to me because I was the minister during the last big Ebola outbreak about 10 years ago.
Diffid.
Yeah, and when that happened 10 years ago, I got together in Paris immediately with Mark Green, who was the head of USAID. We went for a walk over that bridge with all the padlocks on it in the margins of I think it was a G7 development ministers meeting. And we worked out funding. And I think we put in an extra 100 million, USAID put in an extra 100 million. Why does it matter? It matters because that allowed us to fund protective equipment, getting the nurses to the front line, doing the testing, developing the vaccination. I then went out to Eastern DRC. I went into these Ebola centers. I sat with a nurse who very sadly contracted Ebola and was dying in front of me. I saw children whose parents were in the center dying. We were washing ourselves in this very, very intense way to try to make sure there was no fluids of any sort. Because
is it through fluid that you get it?
Yeah.